The Clinician Scorecard is considered one of the most important in the suite of reports produced by DHSV. It has been developed specifically as a feedback mechanism for clinicians across all agencies and the Dental Hospital of Melbourne. Its design has had input from agencies and the Dental Hospital through the Public Oral Health Leadership Council that has a number of clinical representatives on it. The scorecard provides a two-page summary of a number of measures of a clinician's activity within a selected period. It combines a number of the measures that are available across many of the titanium reports that are relevant to clinical staff into the one scorecard report. It is anticipated the scorecard would be an important tool in the performance feedback and peer review discussions. The report function also allows an individual clinician to compare their clinical activity with other clinicians of the same type across the whole agency. It is anticipated clinician scorecards would be generated regularly, possibly on a monthly basis by clinic managers. Specific care needs to be taken in generating the scorecard, as incorrect use of the filters can produce incomplete or misleading results for the clinician. To access the scorecard, simply click on the Productivity Reports group of the Titanium Reports menu and select the Clinician Scorecard in the sub-menu. Displayed here are the available filters for generating the scorecard. As with all other reports, your agency's password code needs to be entered in the Agency Code field as described in the report's overview video. The start and end date defines the reporting period where the report generated will provide activity that is within the date range entered, with the exception of the service profile and clinical indicator data that is provided for a full 12-month period. The clinic filter allows the scorecard to be produced for a clinic site where the titanium database you are generating the report from covers more than one clinic. It should be noted the clinic filter is not applied to the quality clinical indicator data. On most occasions the clinician scorecard is run, the clinic filter will be left on the default setting of all so as to produce a complete scorecard for the clinician regardless of what clinic they have worked at. However, if wanting to produce a scorecard for activity at a single clinic, specific care must be taken when selecting the options under the clinic filter. This is because the treatment service data and the appointment data reference different clinic tables in titanium, and therefore different clinic codes may be applied for each. Therefore, you must ensure that all clinic and subclinic codes related to the clinic site you are filtering to are ticked. Otherwise, some of the service output or appointment data for the clinic site may be missing from the scorecard. If unsure if the clinic code displayed in the drop-down list is used or not, it's best to tick the clinic anyway, just in case there may be appointment or treatment data linked to it. The provider filter will of course be used when generating the scorecard for a single clinician by selecting the titanium provider code for that clinician from the drop-down list. The provider type and provider registration type filters are left on the default setting of all when running the scorecard for a single clinician. But when running an overall scorecard for a group of clinicians, so a clinician can compare activity with others, these filters would be used. As an example, if providing a clinician scorecard to a dentist in your agency, you would also want to provide an overall scorecard for all dentists for comparison. To do this would be by selecting dentist in the provider type drop-down filter. As well, you should also select general registration in the provider registration type filter. Failing to do that last step would produce an overall scorecard for all dentists, including student dentists. Most likely you would want to exclude students in the overall comparative report for dentists, as student activity would skew the results. The provider registration type drop-down filter can be used if wanting to produce a scorecard for all students working at your agency by simply selecting the student registration under this filter. A sample of the Clinician Scorecard is displayed here. The Clinician Scorecard is made up of 4 main sections summarising a provider's clinical activity. They include service output, which mainly represents the clinical treatment activity measured from the treatment item codes entered, the service input, which mainly represents appointment data, service profile, which provides information on the types of treatments provided, and service quality, that provides the clinical indicator, retreatment and unplanned return data. There are some key pieces of information you must be aware of with the data displayed in the Clinician Scorecard. Child dental benefit schedule treatment items are included in the service data reported in the scorecard. As well, private practice activity that includes private appointments and treatments under private courses of care is included in the scorecard report. Voucher activity, on the other hand, is excluded from the scorecard output, so that the scorecard only represents in-house activity. And all the data displayed in the Clinician Scorecard represents that entered in the single titanium database the scorecard is generated from, as defined by the agency code entered. For most agencies, this will represent the activity across the whole agency. However, those agencies with more than one titanium database would need to generate scorecards from each titanium database to capture the full activity for their clinicians across the agency. We will now look at each section in detail to explain the data provided in the scorecard. The service output section provides individuals treated, visits, and DWAR output under 2 tables. The business rules for these output measures are the same as the service mix report, and therefore the figures will match a service mix report run under the same filter parameters. The output is split by age group into child and adult, with a further split of adult output into priority and non-priority clients. The output is also split by course of care type in the table to the right. The service input section mainly provides appointment data for appointment records that are dated within the scorecard date range. The appointment data is split between public and private appointments. Included in the table are the number of appointments, which excludes cancelled appointments, but does include fail to attend appointments. Also included are the appointed hours, which is the sum of the length of the appointments for the clinician that are within the scorecard date range. It is an indicative measure of the clinical hours worked by the clinician. By applying the DWAR output in the scorecard to the appointed hours, productivity measure can be calculated and is displayed in the DWAR per appointed hours column. This represents the productivity of the clinician when rostered to do clinical work. Remembering, the appointed hours does not represent the total hours worked. The table also provides the fail to attend rate as well as the number of appointments identified that the client has attended, but no valid treatment has been entered for the client on the same date as the appointment. This is the same measure as in the attended appointments with no treatment report. The service profile section embeds the current dental care profile report into the Clinician Scorecard and therefore applies the same business rules. The data in the service profile table of the scorecard represent the number of services provided for every 100 individuals treated. It is important to note that the data does not represent the entered date range for generating the Clinician Scorecard. This will often be run for short periods, which can produce skewed and misleading service profile data. The data reported for this section references a 12-month period up to the end date of the scorecard report date range. This 12-month period date range is displayed just above the report table. The columns of the service profile table provide a split between children and adults, with a subgroup of high-risk children and priority adults included. This allows the clinician to view the types of treatments they normally provide to different patient groups they treat. The different service types are represented by the rows of the report. The treatment item codes are grouped into these service types and you can refer to the Titanium User Manual under the Reports section 8B5 if wanting to know the item codes under each of these service types. The first row of the report provides the number of individuals treated that the service profile data is based on. Where the number of individuals treated for any of the groups is low, profile data for that group should be viewed with caution or even ignored, as it won't be representative, coming only from a small number of patients. Remembering the numbers in the report are not a total count of the services provided by the clinician, but rather the number of each service type provided for every 100 individuals treated. The first and main part of the service quality section of the scorecard provides quality clinical indicator data for the clinician. This data represents the retreatments and unplanned returns for the clinical work undertaken. DHSV for a number of years has been producing quarterly quality clinical indicator reports for agencies that provide the unplanned return retreatment rates across a number of clinical treatment areas for the agency, compared with the region and the state. The Clinician Scorecard now provides the ability for agencies to generate clinical indicator data themselves, or for their clinicians individually, or for a group of clinicians such as all dentists. It is important to emphasise to clinicians that the unplanned returns retreatments do not fully represent failure of the initial clinical treatment. They represent repeat treatments that may be the result of failure of the initial clinical treatment, but may also be the result of other factors that the clinician has no control over. The intention being that these measures are just indicators and provide a monitoring mechanism for repeat treatments. They allow you to identify where and if any investigation should occur if outlying results appear for any of the measures. Similar to the service profile data, the table in the Clinician Scorecard reports clinical indicator data for a 12-month period and not the scorecard report date range. The period the initial treatments are being measured for is up to the end date entered for generating the scorecard, minus the clinical indicator retreatment period. This initial treatment period being measured for each clinical indicator is displayed in the scorecard table for the clinical indicators. Other points to note with the clinical indicator data is that student work is excluded from the initial treatments, and therefore clinical indicators are only measured for employed clinicians at your agency. As mentioned earlier, the clinic filter does not apply to the clinical indicator data table, meaning if you do filter to a single clinic, the data in the clinical indicator table will still be for the whole agency. The clinical indicator measures are calculated from the treatment item codes, which assess whether certain item codes are used on the same client and possibly the same tooth within the retreatment period following the initial treatment. For details on the rules and item codes used for each measure, please refer to the Titanium User Manual under the Reports section 8B5. When generating the Clinician Scorecard, you will observe labels for each of the clinical indicator measures are links. Clicking on any of these links will produce a separate report providing the details of the individual retreatments and unplanned returns that are reported in the number retreated column of the table. This retreatment detail allows you to identify the client, the course of care, when the initial treatment and retreatment occurred, what item codes were used, etc. For the restorative retreatments, the detail also provides which tooth surfaces were treated. The second part of the service quality section of the Clinician Scorecard provides a small table giving account of the number of decayed, missing and filled, or DMF records entered by the clinician in the period of the scorecard date range. This count is compared with the number of full examination as measured by the number of 011 item codes in general and denture courses of care. It is expected that a full electronic chart will have been recorded or updated as part of a full examination. And if a full chart has been recorded, it is then expected that a DMF record be captured. As you can see, the scorecard is measuring compliance with DMF recording by calculating the number of DMF records as a percentage of the number of full examinations. So overall, the Clinician Scorecard is a useful and highly recommended report to run regularly for your clinicians to provide them feedback on their clinical activity. We strongly emphasise that whoever generates the scorecards needs to ensure the instructions in this video and the Titanium user manual are carefully followed to ensure a complete and accurate scorecard is produced.